Okay, good afternoon. So we're going to get started here in a minute or so. Just let everybody join the Zoom call. I'm really excited for today's Lunch and Learn. So we have Kevin Lang on the call today to discuss InteliRide. I know that a lot of the folks that we serve depend on InteliRide to get to their doctor's appointments. So this is a great opportunity for us to be able to hear from the horse's mouth, like some of the processes and procedures. Kevin has, I believe, 3 other people on the call as well to help field any questions. I just want to say that we are going to hold all questions until they're ready to answer them. So they'll give a short presentation and kind of go through the questions that we outlined in the Zoom link registration. And then they'll be able to answer questions towards the end. So if you have questions between now and then, please feel free to put them in the chat and we'll just keep track of them. And then once it's question and answer time, we'll go ahead and start addressing those. So if you have does anybody have any questions before we get started, Kevin, from your team?
No, I don't.
Wonderful. So I'm going to go ahead and stop sharing my screen and turn it over to the InteliRide team.
Okay, welcome everybody. My name is Kevin Lang. I am with InteliRide, the group that provides non-emergency medical transportation. And we're going to go over some points about what it is we do, what is non-emergency transportation, and some great questions Angel came up with. And then after that, we'll open it to you all. So with that in mind, looking at the outline Angel put together, first question is, what is non-emergency medical transportation? What we do is basically doctor's appointments. We, through Medicaid that you have, or that your patients and clients and members have, they're given free rides to doctor's appointments. And that's done through a clearinghouse. The state subcontracts that out. So it goes to a single place that organizes it, collects it, and dispatches vehicles and stuff. That is our company, InteliRide. So the way the process works is you call us 2 or 3 days in advance of the doctor's appointment or any medical related appointment, maybe it's lab work, and we will schedule a ride for you to get to and from that appointment. Now, a couple caveats about that is we used to be statewide providing transportation, but that has changed and we're now down to the 9 counties of the Denver metro area, Fort Collins, and Boulder. So folks in communities outside of those metro areas are supported directly by their county, meaning you would not call InteliRide for a ride, you would call your county. One thing we do provide statewide, though, is mileage reimbursement. The idea of the program, and the charter of the program, is the state says you need to provide transportation as cheaply as possible because it's a taxpayer benefit. So the cheapest ways for us to do that are through either mileage reimbursement or through bus passes. Mileage reimbursement is where you get yourself to your own appointment by perhaps yourself or a friend or a relative, family member, spouse. And if you schedule that with us, we will reimburse you 46 cents a mile. And that is a process that involves some forms and stuff. It's government work, of course, so there's forms and paperwork. The good news is the forms are only a page long, and they're all on our website, which I'll make sure to put up here if it's not. And then from there, it works to basically what everybody gets is a bus. Now, since our target demographic is largely people who are disabled or struggling in some way that they're using the government support program, a bus is not a practical solution. There's a lot of folks with wheelchairs. We have folks, with say dementia. We can't put them on a bus or tell them, hey, go find the bus people yourself. So for those, for anyone who needs a ride to a doctor's appointment, it's something more than a bus trip or a bus ticket. We provide that as well. We'll provide door-to-door, car-to-your home service to pick you up at home, take your doctor's appointment, and then come and take you back home. What we need for that, though, is there is a form that you fill out with your doctor called an LOS, level of service. That too is on our website, where basically it explains with you and your doctor why your condition is such that you can't just make it to the bus. You need a car to come get you. Again, the service is free regardless of what kind of vehicle we provide for you. And that form is also on our website. And the good news is, it, like all of our forms, is only a page long, which for government work isn't too bad. So the way it works is you call us with a couple days notice, which is why we're non-emergency. Meaning if you're having a heart attack, that's something you call 911 for. That's not something we provide. We're not in the ambulance business. We are in the transportation business. Though, if medically necessary and scheduled, we can provide ambulances. We call it advanced life service and basic life services, if that's what's needed to get you through an appointment. We need as much lead time on that as possible, as you can imagine, because there's not a lot of ambulances companies who want to work for government rates. So who is eligible and where are NEMT trips available? I'll take this piece and then I'm going to hand it off to Chrissy for the next one. Who is eligible is anyone on Medicaid in the state of Colorado. If you're on Medicaid, you're automatically eligible. So how you get signed up with us, I'll let Chrissy explain that. She's one of our leads and she's in there doing the actual work. I'm managing a lot of it, but she's in there doing the work. So she'll be able to speak to it the best. So eligible is, yeah, anyone who has Medicaid, and we do not handle Medicaid eligibility at all, just a heads up. What we do is when we call us, the first question we'll ask you for is your Medicaid number, which you know is a letter and then 6 numbers after it. And the very first thing we do is we check it in our database to make sure Medicaid's current. If Medicaid is current, cool, done, out of the way, we set you up for a ride. If it's not, we're not involved in that process. That's something you work with Health First to get your Medicaid recertified. You know, we're not in the paperwork business, we're in the transportation business. And where are NEMT trips available? Through Medicaid, they're available anywhere in the state. Should be available to or from anywhere in the state. What our company does is we handle the Denver metro area, Boulder, and Fort Collins. Our footprint used to be the whole state, but logistically it was too impractical for us to do. So we just handle those large metro areas. But though I said NEMT trips for you on Medicaid to get to a doctor's appointment are available anywhere through the state of Colorado. If you're not in our service area, you go through your county. And one of the things we consider on that, because it's a taxpayer benefit, is we want that to be as close as possible. That being through the county or through InteliRide. Meaning, let's say you live in Denver and you have a favorite dentist in Grand Junction. Well, that's going to be awfully expensive for us to spend hundreds of dollars to get you to a dentist when we know that you could get a dentist probably within a few miles. So there's restrictions like that for practical reasons. But if you have a specialist, like as you can imagine, Denver Health has specialists that are very unique to that organization because it's so big. So we have people from all around the state that will come to Denver Health for stuff. Okay, the next point is how do we help people sign up for InteliRide and how do they schedule trips? Chrissy, I'll hand that off to you.
Okay, hi. So how we set you up is of course, we have to check Medicaid. If you are approved, then all we have to do is set up a profile with your name, just some simple information. So your name, date of birth, address, phone number, and then we can set up a ride for you. What was the other?
How do people schedule trips? when they call in, what's involved? What will you ask them? What do they need to know?
Okay, so when we book a trip, you will always need the address of where you're going. It's good to know the facility name or the doctor as well, because we do have to look it up and make sure it is approved through Medicaid. So if it is in the system, the Find a Doctor system, then we can book the trip. Like Kevin was saying, we do need 2 days in advance. We do have a few things that we can do the same day or next day, like dialysis, chemo, radiation. We also do discharges. And what's simple about the discharge is a nurse or somebody at the hospital can call us and say that this Medicaid client needs a trip home, and as long as they have the right Medicaid state plan, then we can set up the discharge and take them from the hospital to their home, or kind of anywhere in our area that we can take them to. So if they needed to go to a family member or something else.
Sorry, Chrissy, this is Kimberly.
Okay.
I just wanted to add on to what Chrissy was saying. Some of the most common confusion that we have is when members call in and they'll say, for example, well, I'm going to Lakewood Eye Office and I don't know the address. Fortunately, because of Medicaid guidelines, we have to have the physical address given to us on the recorded line. And the reason for that is then if we just Google it by the name of the facility and then the member is transported to the wrong destination, that be rejected because it wasn't at an appropriate location, and then the driver doesn't get paid and it causes a lot of confusion. Also, most importantly, the member doesn't get to their appointment on time to the correct location. So that is something just for you guys to educate others on in your field, or even as members to educate other members. They do have to have that address to the location of their destination, even if they have the name of the facility, just again, to verify that we're taking them to the correct location. Okay, thank you, Chrissy. Sorry, go ahead.
No problem.
So that is the calling in piece. What we also have, and this is something we've built up in the last few months, it's absolutely fantastic, is a chat tool. So you can, there's various ways to get a hold of us. The most common way is by phone call. But right now, if you called recently, you know that there can be a wait attached with that. There's other self-serve avenues where you can download an app to your cell phone, either Apple or Android, and book trips yourself. You call us to set that up, or a web page that you can go into EcoLane, which is the application you would download, and book your own trips. Again, we would help you set that up. And on our website is a chat tool, which is fantastic because there's different ways you can interact with it depending on your level of comfort. You can go to the chat tool, which is on our website. It's on the bottom right of the page. It's open during our business hours, which are 8 to 5, Monday through Friday. When you're calling to book an appointment, to get a ride to an appointment, you do need to call during those hours. But with the chat available, you can either wait on the chat and talk to a real human and interact, or we have it set up so the chat will ask you the questions we need to know about to get you a ride. So you can just go onto the chat tool, just answer its questions, the same questions we'd ask you, hit submit, and then a human being will book that trip later in the afternoon. So in that case, you'll be in and out of the whole experience in 3 or 4 minutes. And then we'll even send you back a confirmation email with the trip number once we book that trip for you. So for folks who get stuck on the phones and don't like being stuck on the phones, or maybe you're at work and can't sit on the phone, the chat tool is awesome. It's always up on our webpage, and it works from a cell phone, believe it or not. It's pretty small, as you can imagine, but all that functionality is available from a cell phone. Okay, the mileage reimbursement program. That is part of the NEMT, wherein, as I mentioned, if you're on Medicaid, you can get yourself to the appointment via a friend or a neighbor or a spouse or a kid, whatever it is, it doesn't involve us. You can file for reimbursement, which means you'll get paid 46 cents a mile for the distance you traveled to and from your doctor's appointment. What's entailed in that is you need to call us ahead of time to schedule the ride. And that part can be same day if it's just mileage reimbursement. Call us and we'll get you set up in the system, and we'll book the ride in our system, and then we'll mark it for mileage reimbursement so we know not to send a car. That way we have a record of the trip. You'll print out a form from our website and bring that to your doctor's appointment. And your doctor will sign it to say, yes, he or she was here. And then you or they, whoever you can get, sends that back to us by fax or email, and then we will issue you a check for that travel. Now, it's not a fast process. It takes about a month for us to process that before you get the check in your hand. But it's pretty great because if you're able to travel on your own, we still want to support you, and Medicaid still wants to support you. Okay, how do members request a preferred transportation provider? All right, preferred transportation provider. Let me explain what that is. Generally speaking, when you call us, either us or the computer is going to assign a driver for you. We've got such complex systems that the computer can find the driver for you and send them to your house. However, if you have a company that you love or trust or that you work with a lot, you can have them be your regular provider. And that's a free service. And we love it too, because they know exactly where you live. They're not driving around the apartment complex looking for building G. You can build rapport with them. That does require a form though, of course. It's the form that's on our site. And that is something where you would fill it out, and a doctor's office, whatever your doctor's office that you go to, would fill it out saying, yes, it's best if she, always travels with Hello Taxi or whatever. And like I said, that's free service. We can knock that out in a day or two. We just ask that if you are involved in the requested preferred transportation, it should not involve the transportation company at all. We don't want them handing out paperwork or touching paperwork for HIPAA reasons. So they should not even be like lobbying you or suggesting that they be your preferred provider. That is a process strictly up to you and your doctor. But like I said, it's a cool service because then you're going to get, when available, the same company, hopefully the same driver. Now, again, that means when available. If there's a circumstance where that company or driver is double booked, you'll still get a ride. It just may not be from the same company. But like I said, it's a cool and a free service where if you're going to the same appointment 2-3 days a week, like dialysis or such, why not have the same driver and same company? How to address frequent barriers accessing InteliRide services. This is kind of an open-ended question, so I had to do some inferring. You're probably meaning, what about people with languages, different languages or communication disabilities? How do they get to your services? Well, we have it designed so that hopefully anyone with any kind of disability can get a hold of it. For people who are hearing impaired, there's the TTY relay service. That number is on our website. We have translation services for virtually every language. Like most call centers, we have Spanish speaking in the house. So if someone speaks Spanish, press 1 or press 2, you'll get to one of our live humans who speaks Spanish and will process it for you. Any other language besides English or Spanish, still totally supported and totally free. It'll just go through a translator line. but they can handle, well, not come across a language they couldn't handle. And again, that's all totally free service for you. Also for people who may have speaking impairments or hearing impairments, there's the chat tool where you don't have to be on the phone. There's the app, the free cell phone application you can download on your phone to book trips from. And there's the website where you can get your own login registration. Another thing that helps out with barriers to for disabilities is anyone else with the right information can call on your behalf. The deal is we verify you with 3 pieces of information when you call. We ask for your Medicaid number, your full name, and your date of birth. That's so we know you are who you say you are. With that information, you're now good to book anything or request anything. The good news is someone else can call on your behalf with that information and book on your behalf. You know, a doctor, a caregiver, a child. As long as they have those 3 pieces, they can book a ride to a doctor's appointment for you. The good news is we don't see a lot of fraud and people trying to steal rides to doctor's appointments. So it's not like that's locked down really heavy. The easiest, whatever the easiest way for you to communicate with us is, we're happy to help in something. We're towards the end of my talking points, by the way. So if y'all have questions, we'll get to that soon. Okay, the last question Angela has listed for me here is, what considerations do Health First Colorado members living in rural areas need to keep in mind? Excellent question. If you're in a rural area, I'm going to generalize and mean you're outside of the bigger metro areas of Denver, Fort Collins, and Colorado Springs. If you're not in those areas, you are supported by your local county. Also, Colorado Springs, we do not cover. That is obviously not rural. That's a very major metropolitan area, but that is no longer covered by it. So on our website, there is a list of all the providers and all the counties and the county phone number. So it's set up so that if you are in Alamosa County, you can either call Alamosa County, or we have lists of the phone numbers of the providers who service Alamosa County, and you would go through them. That being the case, you would not deal with InteliRide at all. That would strictly be an interaction between you and your county. Though we do support mileage reimbursement statewide. So if you're in Alamosa County and your daughter takes you to your doctor's appointment and you want to get the 46 miles an hour reimbursed for that to pay for your daughter's gas or whatever, or your neighbor, that does go through us at InteliRide. So you'll still call us to set up that appointment. What you want to do is just mention when you call, I'm setting this up for mileage reimbursement. Because if you call and say, I'm calling to set up a ride in Pueblo, we're going to tell you, oh, I'm sorry, we don't service Pueblo. But for mileage reimbursement, we do. It's easiest, obviously, for the state and the county if we keep that all in-house, because logistically, it's very complex. What I will do after this call is send out a list of links that I keep referring to. But the cool thing is I keep talking about our website, which is gointelride.com. Note that it's not InteliRide.com, it's gointelride.com/Colorado. All this information, forms and paperwork and rules are on that website. It's a very cool, resourceful website. And believe it or not, it's the same website that we use internally for our employees. You know, most companies have their own intranet of secret access to stuff that the general outside world can't see. Everything we do, because we're a taxpayer program for you, is totally transparent. Oh, I should note one other thing. There's another rule. Of course, there's rules. It's government work, but it's a logical rule. The doctor that you're going to go see has to be listed and registered with Health First. Health First is the official Colorado Medicaid vendor, overseer. So, and they have a really terrific website and application called Find a Doctor. In order to know that they're registered with Medicaid, it needs to be a site registered with them. In that site that we use, and I'll send that website out to you, the same site our employees use to see if they're registered is the same site you use. Again, everything we do is public. And the reason for that is we have to make sure that you're going to a doctor's appointment. As I'm sure you know, there are many programs for state programs for people with Medicaid, Medicare that can take you shopping or to the movies or to different things. Our program, though, in our company, InteliRide, specifically handles just the transportation piece, the doctor's appointment. So we will ask you on the call, what is the nature of this appointment? What that means is we don't want to know my left toe is bleeding and making strange sounds in my knee crackle. Just say podiatrist. You know, for HIPAA, we don't want to know any more medically than we need to know. It's not our business. We just need to know that it is going to a doctor's appointment. So that's why our reps will ask, you know, what kind of appointment is this? You can just say primary care, you know, podiatrist. Just a general answer, and then we'll check to make sure that they are registered with us. So that if you're going to see a snake doctor yoga practitioner up in Craig, Colorado, that may not be covered service by Medicaid. So they have to be, but they may be. That's what we use the website for to check, because our employees certainly don't know every doctor in the state. But every doctor in the state who wants to be part of this program has to register with the Health First site and the Find a Doctor tool, which is cool. And again, that is yet another website that I will send to you, and all of that is linkable through our website. And actually what I'll do, since Angel has the master list of everyone joining us, is I'll send her the key web links I'm talking about, the internet sites, and let her disperse that to you guys.
You
So-
also have the ability to share your screen, Kevin, just so you know. So if you wanted to show the website, you would have that ability.
Oh, I appreciate that. Well, let's do that. Let's pull the website up because it's a pretty great website. And that would certainly make a lot more sense for all y'all. All righty.
While Kevin's getting that set up, you can put your questions in the chat or raise your hand, and we'll call on you the order that you raised your hand after we do questions and answers.
Okay, let me find out how to share my screen. Share screen. Okay, so for those of you on computers, in a few seconds, you will see our website. And I'll take you to, okay, cool. So this website here, as you can see, gointelleride.com/Colorado. As promised, down here is the chat site, so what we call a widget. And once you click on that, that opens up and it asks what you want to do. You want to book a trip, mileage reimbursement? It's a super cool, amazing tool that if you haven't used it in the last few months, I highly recommend. Our amazing supervisor, Josh, has built this thing out to be one-stop shopping. You can do everything you could do over the phone on this chat, but much quicker for you. It's awesome. Okay, I'll minimize that. Back to the website. On the main page is how to get a hold of us and our hours, the most important stuff. Links to the self-service options, which are where you download something to your cell phone or you go to your own website. And here's the chat. You can disregard this link because it goes to the same pieces here in the corner. Now I mentioned forms. Because it's government work, we love forms. But like I said, the forms are awesome because they're only one page. When was the last time you went to a doctor's appointment and only filled out one page? So here are tutorials on everything we do. Like I talked about, all the stuff I just talked about is all right here. How to ask for preferred transportation provider, how to do mileage reimbursement, how to book a trip, that's the part Chrissy talked about. RTD discounts, RTD being the Denver bus, the name of our Denver public bus system that we use. And here are all the forms. I'll show you the main form that we use for kind of everything. It's called the level of service medical recommendation form. This is if you need an exception, meaning if you need something other than a bus pass. This is the form you fill out with your doctor that explains the diagnosis and what it is why it is you can't take the bus. And it's something that your doctor will also sign at the bottom. It's also how we handle things like if you have an extra large wheelchair, which we designate as anything wider than 22 inches, I believe, and anything that is more than 350 pounds with the rider and the wheelchair combined. If that is your case or your patient or member's case, that requires a special vehicle, as you can imagine. That's going to need, I can't have, a lot of the appointments, it may just be someone showing up in a Prius who's just going to, you pop in the back seat and they take you to the doctor's office. Well, if you've got an electric wheelchair, or especially an XL electric wheelchair, a Prius isn't going to help you, right? But we'll still take care of you and we'll still get you that appointment. But as you can imagine, we've got to know that ahead of time. That's what the paperwork is for. There's a whole section here about wheelchair information. Do you have a service animal? Of course we'll accommodate service animals. That's state law. But we'd like to know because we may have some drivers who might be allergic to service animals or dogs. So any kind of exception you need, that's what this form is for. And if it looks too complex or too busy, or you don't understand the questions, just bring your doctor's appointment. They fill this stuff out all day long. They know what all this stuff means. It's one page, and you can either print this out from home, or you can have your doctor's office print it out. We do not send these forms out, but we host them on our website. And we also try and be as flexible as we can about you getting these back to us. You can email them or fax them. We even have people who take pictures on their cell phones and email them to us. If you take a really good, very clear photo, we'll probably allow that. But obviously we prefer if it was scanned or faxed to us because this is, this paperwork, this font and stuff, some of it's really tiny. So a photograph of it, we're going to miss a lot of information. We also ask for 2 business days for us to process this. Meaning if you get this to us on a Monday, ideally, whatever it is you're requesting or telling us here, we should have in our system by Wednesday. One more thing I want to add is for calling, because calling is the most common way of getting a hold of us, is Mondays. If you called on a Monday, it's terrible. And we're working on that, and we're always working on it. But if you can avoid calling on a Monday, it's in your best interest. Because on Mondays, we get basically double the call. And as much as we want to staff up for that, we can't really hire someone and just tell them we only want you to work Mondays. So it's our regular staff, but we do all hands on deck on Mondays. So know that Mondays are tough and we know it, and we throw everything we can at Mondays. But honestly, anytime you can book an appointment, we still want a couple days notice, but if you can avoid calling on a Monday, it's in your best interest. Doesn't much have an impact on us, really. We're going to answer the call no matter what. But, the reality is you could be waiting 20, 30 minutes on a Monday to talk to a human. On another day, it should be far, far less than that. And also remember, there's the chat option, where even on a Monday, you can be in and out in 3.5 minutes. Because the computer's going to ask you the questions we need. It feeds us those questions, and then we book that trip.
Kevin, I just had one quick thing. This is Kimberly again with InteliRide, everyone. And I just wanted to add something. We see this often, and it will save you a lot of time as well if you know ahead of time. If you can scroll up a bit, Kevin, to the top of the form where the diagnosis section is at. Yep, perfect. So when these level of service forms are sent in, often in the diagnosis field, what we'll see is something, maybe it just says depression or it just says pregnancy. Those are not reasons explained sufficient enough for us to be able to approve that increased level of service. So there has to be an explanation. The best way to go about it is whatever the condition is that prevents the member, whether it's cognitive or physical, whatever the condition is that prevents that member from being able, for example, to ride public transport, that's what needs to be explained in that field. If they have other medical issues that doesn't affect their transport level of service, that's fine. For example, high blood pressure or something, if it's not affecting that member being able to ambulate onto their transportation, it doesn't have to be included in that diagnosis. So again, quick reference for you guys, because I know time is very much of the essence, especially for those of you that work at a facility. Best rule of thumb, just explain the very condition that we need to recognize that requires that member to have a higher level of service. We start at public transport with bus tickets because it goes by lowest cost. And then we go up from there to an ambulatory vehicle. We have wheelchair lift vehicles. And again, to Kevin's point, if it's extra large wheelchair or they have a leg extension or anything like that, those need to be included on here because there are different types of paratransit vehicles. Some, their lift only lifts up to 350 pounds combined weight. Some go up to 500 pounds or higher. So we need to know that, so we send out the proper vehicle. All of this, the proper diagnosis and the important details about the member and their weight is all in an effort to get the member to and from safely to their appointment on time. If we dispatch the wrong vehicle and it shows up, and then we have to correct that later, 9 times out of 10, that member is going to miss or need to reschedule their appointment. And that's the very thing we want to avoid, of course. So again, if you have any questions, feel free to call us. We can walk you through. But in reference to that diagnosis, it does have to be a full explanation of the condition that we need to consider to override. Thank you.
Thank you, Kim. That's what I have for my talking points.
Okay.
So I think we can open it up to any questions y'all have for us.
Yeah, so we have a couple of questions in the chat and I'll call on them based on how we receive them. So the first question is, are emergency Medicaid recipients eligible for InteliRide?
Kim, I'll let you speak to that.
So-
I'm not familiar with emergency Medicaid.
So, yep, there's different plans, Kevin. That would be one of the plans. Like there's the state Medicaid, and then there's one for emergency services only. We do not, to answer the question, we do not handle any, even if they're eligible, that is a different market. InteliRide only handles non-emergent. Now, we do have a category called urgent that both Kevin and Chrissy touched on earlier. Those are trips that need to happen within 48 hours. And the reason behind those typically are that if the member were to wait and reschedule to meet our 2-day rule, if it was going to be detrimental to their health or could potentially make their condition worsen, those are ones the state deems as urgent. That's why Kevin and Chrissy mentioned dialysis and chemo and radiation. Those are life-sustaining services. So we're going to consider those urgent regardless. So if an appointment comes up and the member has to book for those, we're not going to mess around with asking too many questions. We're going to get the trip scheduled. However, if somebody were to call in and say, hey, I have a dental cleaning tomorrow I need to get to, that trip would be denied. The trip would be built in our system, denied for the appropriate reason, which would be not called in within 48 hours notice per our guidelines, because that particular trip, unless it met urgent criteria, would not qualify. Now, to meet urgent criteria, it boils down to this. 1 is the service life sustaining, which we talked about, or 2, did that member just become aware of this appointment? In other words, woke up this morning, child's not feeling well, child may have an underlying health condition, and maybe perhaps the doctor's office said, if they spike a fever, give us a call. Parent calls in doctor's office, they say, yep, we need to see that child right away today. That would qualify as an urgent trip because they were just made aware of that appointment. So there's no way they can call us 2 days in advance, right? If they call that morning and the doctor's office says, yep, we need to see you right away. Now, that does not cover trips where the member woke up and said, today would be a good day for me. I'm going to call and see if the dentist can get me in for a quick cleaning. That would not qualify as an urgent. So again, just to explain to everybody, the deciding factor in that is A, is it a life-sustaining service? Or B, is that trip considered urgent because it was just scheduled or requested by the doctor's office or the primary care in the last 48 hours? So hopefully that will help you guys. I know there's a lot of confusion on what urgent is versus emergency. Urgent just means they need to be seen or potentially their condition could worsen. Emergency is life or death, potentially. So we do not do any emergency transport.
Thank you, Kimberly. I think Diana was talking about people who were it's emergency Medicaid, like they get put on Medicaid in an emergency. It's not the transportation. Diana, do you want to explain this a little bit more, like the cases you encounter for Dr. Mack?
Yes, thank you. So yeah, I was more meaning, so emergency Medicaid recipients are usually people who are undocumented and they've been approved for Medicaid for a life or limb situation. And so my question was, so if they needed InteliRide to go back to the doctor for that same reason, would they be eligible to use InteliRide?
So long as they are in the PEAK system, which is where we look up eligibility, and so long as in addition to that emergency, because I know that's a separate type plan, if in addition they have the state Medicaid plan, then yes, we would transport them. That's the key factor for us. I know there are many different plans under Medicaid umbrella, but it's the state Medicaid plan that qualifies them for our type of transport. So
how would they know that then? Just by calling you?
Yep, they can call Health First Colorado and find out, or they can call InteliRide and say, I just need to see if I qualify for rides through you all. We quickly look them up in PEAK and we can answer that question in 30 seconds once we verify their identity.
Okay, because I mean, in addition to that would be, what about people who are in the buy-in program for Medicaid? I mean, it's technically considered
The one where there's a copay for them?
Right.
Yes. So again, in our system, we look up if it shows they're under the state Medicaid plan. Now, sometimes it'll have in our system a determination saying they have not yet met their costs, in which case they don't qualify for transportation through us yet. So they do have to meet that cost, and it's updated in real time and through Health First Colorado, we would see that. So if, say, the member met their share of cost by the 5th, then on the 6th they called in, we likely will be able to see on the 6th, now it's showing them as eligible. So until they've met their share of cost, they do not show to us as eligible.
Okay, and when you say state Medicaid, that doesn't include people who have an HMO, correct?
Right. So
Okay.
basically, the Medicaid determination is done at Health First Colorado. And as you are all aware, there's many, many different levels. Some people qualify for financial, some people qualify for medical. So there are different variety of different plans. The one we're looking for is the state medical plan. And you're right, most members will not know what plans they're signed up for, right? Because there's usually multiple. Some have waivers, some don't. But the easiest way for them to determine is contacting Health First Colorado to find out, or InteliRide, and we can quickly look up and tell them whether they do or do not qualify for our transportation.
Okay, thank you.
So the next question is from Avelino, and then Anna, I see you with your hand raised, so you'll be after this one. So Avelino asks, what notifications do you all send patients, and how do you send them to them?
So the only notification as far as setting up, at the time that the member or maybe a facility calls in, we give information and verify on that call. Okay, this is the date of your trip, this is your pickup address, this is your drop off, and we let them know who the trip is assigned to. However, there are circumstances where maybe somebody calls a trip in 3 weeks in advance. So there's an opportunity that that trip may change hands, right? We submit it, the provider is first submitted to is unable, and then it moves on. To answer your question, the only way the member is going to get update or any notification is our system will send a text message if the member is enrolled for that. That's something we ask when we work with members on their accounts. If we see that they are not currently enrolled in that, it's just a little box on our end that we check. and they have to have a mobile number. And then we supply that mobile number. And what happens is our system generates an auto text, sending it to them saying, your ride should arrive within 15 minutes. That is the only notification system. Other than that, unless we have to cancel a trip for reasons beyond our control, for example, a vehicle went down, there's no additional vehicles to cover that trip, something of that nature, then our dispatch team will reach out to the member to let them know. But otherwise, from the time they set up the appointment until the day of the appointment, there's no additional reminders or communication outbound anyway.
Okay, thank you.
Mhm.
Anna, you're next.
Thank you. I do have a few questions. So the first one is, after we send a level of service form or whatever, does the patient get notification whether they were approved or denied? I guess that's the follow-up question to Avelino's.
Yep, no, great question. We get asked that often. They typically do
Or does
not.
the patient has to call and ask?
Yeah, they would check, or whomever submitted the LOS. Often what we'll have is our clinical team will respond to that fax or email and state that it's received and been processed. So that may not be the member, as you know. So if somebody from the facility is calling in or sending in that LOS, they're going to be the ones getting the notification via email or fax saying this has been received and processed. We do not make outbound calls to the members just because it's not sustainable for us. Several 100,000 members and you know, several hundred trips a day, so we don't have the capacity to be able to call out to confirm everyone. Once
So
those
that's
LOS
also, sorry, this is Christina. That's also why we have the chat. It's a
Okay.
good way to
Thank
chat
you.
into us.
My other question is, I know you say that we can use this for discharge. Can we use this for a mother who just delivered and is being discharged with baby?
Yes. So what we do in those cases, we have those quite frequently. If mom is enrolled in the system and under Medicaid, we allow the newborn to travel with mom for up to 30 days. But that's only for when the newborn has appointments. Of course, discharge would be covered because mom and newborn are going home. Let's say a week later, newborn is sick and needs to go into their pediatrician. Mom would call and we would set it up under mom's account and add the baby as an additional passenger. But if mom has an appointment alone, she is not able to take newborn with her. The window on that is 30 days that will allow the newborn to ride with mom. Health First Colorado has insured us within 30 days that newborn will be showing in the system for us if they're eligible. And that paperwork is typically done at birth in the hospital. So.
I'm sorry, I missed the first part of your explanation. So after discharge from the hospital.
Yes, they would be, the newborn would be able to discharge with mom. We basically use mom's account as the umbrella account for up to 30 days until that child shows in our system. After 30 days, if they're in our system, they would have their own profile built, the newborn. If they are not showing in our system, we would not be able to transport them after that first 30 days.
Okay, thank you for that response. I'm going to move on to the next question, and I'm going to build off of what Megan had asked. So she's asking, what are the average hold times? And I'm going to add on to that, are there standards of customer service that you all track to show the effectiveness of your service? And are those reports publicly available? So in addition to hold times, what other customer service standards do you all track?
Sure. We track plenty KPIs. We track hold time, the average wait time when they call in until they're connected with a rep. We actually have a very detailed report that I create every month and send over to our client. It is not accessible by public, but that information is sent over to our client, being Health First Colorado, every single month, and it details wow, I mean, it's literally a report that takes days to put together, so very, very detailed. But as far as you guys are concerned, the important things are, yes, we do track the hold time, the average wait time, our abandonment rate, average talk time, all of those things are considered. There are standards set on the contract. As far as an average hold time, which was one of your questions, that's really tough to say. These last 3 months, we have seen a dramatic increase. For as an example, from December till January, we had more than 500 new members introduced into the database, meaning now there's 500 more members that can call for transport. We've seen an increase of over 5,000 trips from December to January. And now from January into February, we're seeing that trend continue and increase. So currently our hold times have been pretty dramatic. Last week, this week, the week previous, actually for about the last month and a half. So myself and my boss are putting together documentation on that. And we are going to reach out to the state and ask to increase resources, have more people on the phones and such to basically for better member service, to be able to answer their calls in a more timely manner and process those. So typically I'd be able to tell you a very average wait time. But right now, like I said, this increase has began in towards late December and has continued gradually to increase week over week. So we are just kind of getting a grasp on what the new average looks like and what those times are.
Okay. And you had mentioned that you had a really steep increase in the number of people taking advantage of NEMT. Do you have a sense of what percentage of Health First Colorado members actually use NEMT?
Unfortunately, we do not have that data because we don't have the information about all people who are enrolled. We only can look them up as they call into us. But what I can tell you is of those 500 members, it wasn't 500 new people all of a sudden using it. It was that from December to January, there were 500 new qualifying Medicaid recipients that are using our service. So I couldn't speak to how many there are that are not utilizing. Unfortunately, I don't have that data.
Great, thank you. The next question we have is, can you show us where on the website somebody could go to find out which providers are certified to be Health First Colorado providers under NEMT?
Chrissy, do you know if we still have that link? I don't have that site up right now. I'm sorry. Okay, you got it. Perfect.
Yeah, I'll show you a couple sites in reference to that. Let me share my screen with y'all. Okay, I think there's two pieces here. This is a site that I'm going to send y'all a link to that links to all the various providers that are certified with the state, and it's broken down by county. So as I mentioned, if you're in the Denver, Boulder, Fort Collins area, you call us. We worry about this part.
Hey, Kevin, I don't think you're sharing your screen. We can't see what you're referencing. Do you mind sharing your screen again?
Yeah, I'm sorry. I thought I had it up.
That's okay. Thank
I
you.
didn't hit the share button. I have it highlighted.
Oh, there we go. Thank you.
So this is a state website that lists the counties that and the companies that are certified with the county. So Adams, for example, we will handle Adams, meaning just call us, we'll find the company. But if you want to work on your own, or more realistically, if you're say in Alamosa County, which InteliRide doesn't support, all of these are companies that are registered with the county.
Okay, so just for a little context, I think everybody who's on this call is in the 9-county service area that you serve. So that's because that's who we advertise this to. So is there a place for us to find out who are certified with you all so that people can select a preferred provider?
That's an interesting question. Kim, do we have a list of all our providers online?
You can find our providers on our website. They'll be in the same, so not in the member resources, but 2 tabs down in the transportation area. That's where our transportation provider.
Is that the list that just has their names with their phone numbers and what languages they serve, but it doesn't have their address, so people might struggle to know where they're at, and maybe they don't need to, but
so
see that list of transportation providers, it's just name and phone number and language, I believe, under that link.
Yeah. In many cases, there are several locations. They have one main location. They do give us an address of where the office is located, but typically because we service several counties, they sometimes have drivers that their pullout address may be their home address because that's their service area, if
Got
that makes sense. So knowing the office address is not going to be very helpful to members.
Okay.
Thank you.
Because it's not necessarily where the vehicle's starting out to come get them.
Okay. It would be good to see like who does serve your area, like your county. I don't know if that's a future project that you all could focus on. But I know we are running out of time. I have 3 more questions. If you all could stay on to answer them, that would be wonderful.
Sure.
The first question is from Evelino, and it's, will InteliRide cover services for patients who have Medicare as their primary and Medicaid as their secondary insurance?
Yes, as long as when they call in, we pull up their account and it shows that they have the state Medicaid plan, it does not have to be their primary to get coverage. So long as they're enrolled in the right plan from our end on peak, then we can assist them with transport.
Wonderful. The next question is about if there's an appointment where parents has their child with them, is it mandatory to have a car seat or request a car seat?
That's an excellent question. So if the child is under the age of 6, the parent does have to supply the car seat. They do also have to keep the car seat with them, meaning when they get to the doctor's appointment, they'll have to take the car seat out of the vehicle into the appointment because it may be a different vehicle picking them up after. But yes, the general guideline is under the age of 6.
Okay, under the age of 6, the parent has to keep it or has to bring it.
Correct. Correct.
Okay. And the question that I have is regarding public transportation. How do you determine if somebody has public transportation available to them? And do you have any consideration for like how complex that trip is? Like if they have to take 2 different transfers and it's 3 times the amount of time versus taking
Yes,
another
ma'am.
provider? Okay,
Yep,
and what is that?
perfect question. Yep, let me just give you a brief overview. So public transit is determined by, when we build the trip, it's determined by the pickup address and the drop-off address initially, right? That's just the primary thing that we look at. Our bus routing system for RTD and for paratransit, their maps have been loaded into our software system. So any trip that's built, the system automatically tells us if that's on a bus route. Now, the conditions that you were talking about are, from a Medicaid standpoint, if the member has to walk more than a half of mile to get to the appointment or to the bus stop to get picked up, we would automatically override, or the system automatically overrides, because the state deems that as too far of a distance to require them to walk. And that's on either end. They might have a bus stop right in front of their home, but then when they get dropped off, they might have to walk, 0.75 miles to get to their appointment. The system is going to look at that and automatically override bus for them. The other thing that it looks at is if the member has to transfer more than twice, it's automatically going to override the bus system, because the tickets we issue will handle 1 ride and a transfer. So if they have to transfer more than twice, we would send additional tickets, and that's just not something that the state will require. So we override for that reason as well. And then thirdly, pretty easy, but if a member lives in an area where the bus system does not service, for example, they're 3 miles from the nearest bus, then again, automatically the system will override.
Okay, and it sounds like you mail those bus passes to the recipient. Is that accurate?
That is correct. And that's why we require the 5 days notice for those that are on public transit. Yes, ma'am.
Okay. Great. So we did have a couple other questions that came in. So can adults ride with their caregivers or their personal care assistants or anything like that?
So, yep, our guidelines on that. Any member who has an appointment up to the age of 18, so the day of their 18th birthday, anybody under the age of 18, automatically we allow an adult to transport with them. Now, if they turn 18, from 18 and beyond, the only exception is if that member requires medically an escort, we get the LOS on file and we will allow 1 additional escort. The guidelines to be an escort, they must be 18 years of age or older, able-bodied and able to assist, and they themselves cannot require an escort. That's the only 2 guidelines. And we don't have to have one particular. So let's say member A has an appointment. They don't have to take the same escort every time. As long as their escort meets those two pieces of criteria, 18 years of age and older, and able-bodied, able to assist, they don't need to like clear each person with us. As long as they're have the LOS on file, it's good for 1 year or the date of expiration that the doctor puts. And we will allow anybody that meets the escort criteria to ride with them. But the limit is only 1 escort allowed per member with an appointment.
Oh, I think Angel froze, perhaps.
Yeah, it did freeze for a minute.
Yeah. Let me see. I forget if we have any other questions. Yes, Corey is asking in the chat, are these public transit rules written down anywhere or can they be shared?
Those would be found on Health First Colorado website. And if they look under member handbook, that should have all their guidelines for the information that we follow as far as InteliRide transport.
Okay.
And I'll put with y'all too, the Health First website, which is a great resource. I'll send that out with the other information I'm going to send out after this call.
Awesome. Yeah, thank you, Kevin. Are you back, Angel?
I am. Sorry about that. I guess I have unstable internet. So I know that we did say that we would only go until 1. So I see that there's another question though, on a couple of appointments have been back to back on the same day. Does it matter whose Medicaid information they use? So if it's like the child's versus the parent?
Yeah, we have to build it under each member that will be billed, because the state, in order to pay that claim to the provider, they have to match it up with a billing. So we can't build like 3 trips under moms for the 2 kids, even though they're going to the same place. But our system does have a way of, we'll build mom and then we build the other 2 and mandatory it to the same vehicle so that mom is riding with those minors and they're going to the same location.
Okay.
So
And just to clarify, pharmacy trips are not covered by NEMT. Is that accurate, or did I?
that is accurate. Yes,
Okay.
ma'am.
So
Mhm.
what are the cases when somebody does have to stop by the pharmacy on the way home from a doctor's appointment? Like what are the solutions around that?
There are no solutions from InteliRide that we can offer. Unfortunately, that is something we continue to work with the state. Every state to state, and I've been doing NEMT for a better part of 20 years. Every state has different rules that they can elect for where they'll transport. So for example, in a neighboring state, they may transport to pharmacy, but not cover chiropractic or something like that. Unfortunately for Colorado, they do not cover pharmacy. We have no other solutions to offer for that. However, if the member does qualify under the waiver program, then that's potentially a trip they can call their case manager and get set up under waiver.
Okay. Well, we'll have to have another lunch and learn on the waiver programs because those are another whole level of complexity.
Right.
But I just want to thank you so much for spending an hour with us today. I know that we probably have a lot more questions, and we could probably have you come to the Mobility and Access Coalition meeting to kind of dig into some of these other questions, maybe down the road later on this year. But I will do my best to summarize what's in the chat, or the links, the resources that Kevin provided in the chat, in the follow-up email. And I will also link to this recording online so you can share with your coworkers who help people who this may be helpful for. And I just want to thank InteliRide staff for taking so much time to explain this to us. I know that there's still a lot of unanswered questions, but I really appreciate this first step.
Our pleasure. Thank you.
Thank you. Everybody have a wonderful day. I'll see you in the email.
Guys, so have a
Thank
great
you.
day. We'll join you again in
Thank you.